Hello, my name is Jamie Gauthier, and I will be speaking on Medicaid reforms through the Affordable Care Act and the Graham-Cassidy-Heller-Johnson Amendment. Medicaid was enacted in 1965 under the Social Security Act. Participating states can receive federal funds. It provides specific benefits to those eligible, and it provides broader coverage for states. Medicaid is the largest source of federal funding to states and is currently the largest health insurance program in the United States. Throughout history, there have been many proposals and reforms to the Medicaid program. The most recent reform includes the Medicaid expansion under the Affordable Care Act by President Obama. The initial law stated that states were required to extend the eligibility of Medicaid to those over age 18 and under age 65 with an income below or at 138% of the federal poverty line. However, in June 2012, the Supreme Court ruled the expansion optional for states. 32 states opted for the Medicaid expansion, while 18 states opted out. One fear of the Medicaid expansion includes an increase in health expenditures to the United States. However, research has shown that the expansion has had a positive effect on care being affordable, using services needed, access to care, and providing security to low-poverty Americans. According to the Medicaid and CHIP Payment and Access Commission, since the expansion of Medicaid, the enrollment of Medicaid and CHIP have increased, while the rate of Americans who are uninsured have declined. According to Wary and Miller, the Medicaid expansion has been linked to lower mortality rates, an increase in coverage and access to care, higher rates of benefit utilization, and an increase in self-reported health. The Graham-Cassidy-Heller-Johnson Amendment is currently proposing many reforms to the Medicaid program. The amendment would repeal the current Medicaid expansion and set new eligibility requirements. Instead of Medicaid being offered to those at or below 138% of the federal poverty line, the amendment would change the percent to 133. This single change will decrease the number of people eligible to receive the benefits of Medicaid coverage. The amendment also aims to cap the funding of Medicaid while placing control of the program to the states. Past proposals on Medicaid include President Bush's proposal to change Medicaid to a block grant program. The purpose of a block grant program is to provide more certainty to the federal budget and a greater incentive to states to maintain costs. Medicaid is currently an entitlement program, which means the government is obligated to fund a service provided for a set of people with no limit on the amount of funding. In contrast, a block grant program provides states with a fixed amount of funds to provide services. Although there have been many proposals to turn Medicaid into a block grant program, it has never been enacted due to not being able to guarantee coverages for low-income families. For example, as an entitlement program, those low-income or disabled persons who meet eligibility requirements are guaranteed certain health benefits. If Medicaid were to be changed to a block grant program, there would be a cap on the amount of federal spending, and the eligibility and health benefits would be decided on the specified funding. The Graham-Cassidy-Heller-Johnson Amendment is attempting to do the same by proposing to cap the funding of Medicaid. As one can see, certain proposals of the amendment can hinder and reduce the availability of coverage for those in need of help. As an emergency room nurse, I understand the importance of providing health benefits to as many people as possible in order for Americans to remain healthy. However, on a daily basis, I'm confronted with issues that patients present to me, such as not being able to purchase his or her blood pressure medication due to not being insured and being unable to afford it. In return, the person comes into my ER in a hypertensive crisis, which puts him or her at risk for a stroke and/or kidney damage. There is no perfect answer to insurance coverages throughout the United States. Medicaid, as well as other programs such as Medicare, will continue to change and be reformed as time progresses. As healthcare providers, it is important that we stay up to date on these changes and enact change ourselves to provide the most optimal programs to the American citizens.